Assalamu alaikum viewers, this is Dr. Khawaja Saajid, orthopedic surgeon. I do hip and knee replacement, arthroscopies, and of course deal with the fracture as well. Today we are discussing about limping in children. When children limp while walking or running, there could be a lot of reasons. The most important reason is infection. As you know, infection is very common in extreme age groups, either very young child, for example, even 1 day old child, or very old patient, very lot of comorbidities and physiologically old patient. So infection in joints is most common in these extreme age groups. They present with limp and pain. If we specifically talk about limping in children, one is infection. That's the most important problem, most important thing to deal with, because infection, if you don't treat at right time, it can lead to septicemia and ultimately death. Once patient in septicemia is very difficult to treat, very difficult to deal with. So early detection of infection is very, very important. Small children is a bit more difficult to detect in those patients because they cannot speak, they cannot walk. So it's quite difficult in those age groups, especially less than 2 years, who cannot walk or who cannot properly express their feelings or problems. So all you can observe is excessive cry. If a very young child excessively cry while washing, while bathing them, or moving his limbs or torsos. When you bathe your child and keep him on the bed and let him play, so he moves his torso, he moves his arms, legs, flex his hips. You observe it. All joints, all bones, all hands, feet, he is moving. But if child is not moving one of the limb, or if you try to give him nappy and pull the hip, straighten the leg, and child cries excessively, there is something going on. Especially the infection of the hip, septic hip, it doesn't give you much swelling or redness. Knee, yes, knee, septic knee or infection the knee can express as redness, swelling, so you can see. But hip, no. So hip, you can find out when you try to pull it, to give the nappy, you try to stretch it, try to straighten it, child will excessively cry. That is the problem. So don't delay it. The most problem is the delay. Septic joint, the septic joint mainly involves the hip or knee and rarely to the elbow, wrist and other joints. But delaying this process is really, I would say, is a big problem for the joint in later age. Either patient will go into septicemia and die, or if his or her body cure it, recover it, there will be problem with the cartilage damage for the rest of their life. So in any case, it is a big problem, is a big issue for the rest of the life. So early detection of the septic hip is very important. So orthopedic surgeon even is sometimes very difficult for general practitioner to diagnose it. All I can say to my viewers with this public awareness program, that if you observe in your child such kind of problem, straightforward go to the specialist. Don't waste your time with the general practitioner for a couple of days, because this is urgency. This is one of the urgent problem in orthopedic surgery to deal with. So straightforward, don't delay, don't waste time. Straightforward, go to orthopedic surgeon who can diagnose it and treat immediately. Once it's treated immediately, you can save the joint. Sometimes you can save the life of the patient. Second thing could be in a little bit older children who are limping, could be trauma. While running, while playing, they had a fall. Sometimes, well, most of the time there is no eyewitness, nobody see them to get injured, and that could be the reason. So fracture, common, or muscular injury, so they can limp. Other thing is without injury could be congenital deformities, which usually not apparent when the child born or when the child is in an age less than 2 years, when he is not walking or running. So once he start walking, running, then these things become more apparent. Or during fall or during any trauma, not necessarily they get the fracture that the bone is broken. Sometimes the bones where they are growing, the ends of the bones where the bones grows and child become taller and taller, that part sometimes slip. That part where the bone grows slip. Medical point of view, we call it fracture, but it slips. And that is also devastating injury. That is really horrible injury, because bone growth arrests there. Bone does not grow. And after 6 months, you can see apparently that one leg is shorter than the other one. So that's the problem. So any child who is limping, I would say immediately go to the orthopedic surgeon, get it solved. Problem could be many involving the hip joint, knee, foot and ankle, foot problem, congenital problems, infection. So many problems could be there. So orthopedic surgeon is the one who can diagnose and who can give you better treatment. So always go to the specialist for such kind of problems and don't waste the time. Don't just treat by yourself at home and see, okay, we'll see after a couple of days once he is better. So in case of children, especially very young children, don't waste your time and don't take risks. Take care of yourself and your family. On display is my number. In case you want to consult or you want to discuss any other topic, you can contact me. Thank you.